Hello, मैं अपने गाना host अतु जमीर आमी खाला talk show Unfiltered ते अपने गान सबके स्वागत करिए से AIDS एकता बीमारी आसे कुंदु मानुखान पिशी जानी थकिलिबी इतु लगा ओपोडे खोता को बोले बाहर ना उलाय स्टिग्मा अटैच होई जानी मिले AIDS सगा पेशेंट्स कान एकला ही नहोगिना इतु लगा ओपोर खोता को बोले भी मोन ना थाकिया भी दिखि पाए किंतु पिशी टाइम प्रा मानु कुनुबा लगा एफर्ट्स काने अवेयरनेस कान फिलाई आसे और सोसाइटी लगा अलग अलग सोपते पुंगचा बोले कोशिश करि आसे इतु प्रा मानुखान HIV और AIDS लगा ओपोर जानकारी कुनुबा थाकिया दो जानि आसे हुलिबी मोय कान किमान जाने और कि निमिदे इत्या भी अवेयरनेस कान थगिले भी स्टिग्मा लगाई गिना आसे इदु सवाल डांगर एकता मोय खान लगा आगे दे आसे आमी खान आजी HIV/AIDS सगा ओपरदे की प्रॉब्लम्स खान थगिया नइले की दिक्तारी कान थगिया लगा ओपरदे खोता कोले आमी खान लोगो दे स्टूडियो दे दुटा स्पेशल गेस्ट आइना आसे आमी खान लोगो दे सर Ketho Angami आइना आसे ताई ARK फाउंडेशन कोहिमा लगा प्रेसिडेंट आसे और ताई एकता हेल्थ एडवोकेट और ट्रीटमेंट एक्टिविस्ट भी आसे और आमी खान लोगो दे डॉक्टर Toghuka Yepthomi आइना आसे सर भी ताई HIV एक्सपर्ट आसे और ताई भी ट्रीटमेंट एक्टिविस्ट एकता आसे तो सर थैंक यू सो मच आमी खान बिजी थाकिबो हले भी टाइम दिकिना आमी खान लगा स्टूडियो दे आइगिना खोता बाची करबले एग्री करिया कारणे बिशी थैंक्स जुनाइ दि आसे
मोस्ट वेलकम थैंक यू
सर तो आमी खान लगा आजि लगा इदु कन्वर्सेशन दो आगे पारेगिना मुइ इदु हुदिबले मुन जाबो सर Toghuka अपनी के फर्स्ट अपनी भी HIV/AIDS तो अपनी लगा जर्नी दो किनिगा थागिसे और इनी also it being your specialization medical laga ini apni bi tu laga pore kiba kole mun jabo sir
first of all thank you for inviting me for this talk show and then first of all I want to tell all of ami HIV/AIDS kam kurana about working in HIV/AIDS field all of kobole mun ase back to 1995 I've been working in HIV/AIDS field. This is almost 26 years, and then 22 years in Chennai, and then 4 years back to Nagaland. So in the last 2 years, I was working in the ARK Care Center, that is the Center for AIDS Research and Education. I used to work there, which hospital is very well known and in the national as well as global. In terms of support services and care and treatment for HIV positive people, and also very fortunate to work Dr. Let's Suniti Solomon, who was the founder director of ARK Care. She is first documented HIV in India, that is back to 1987 in Chennai, and followed by globally HIV is first documented, tested in 1981. That is in the Los Angeles city in the US, and among the gay men, that's called men having sex with men groups. And then yes, those days HIV/AIDS has been 4 decades, 40 years now. So 20 years back, HIV/AIDS is there was no much treatment available or service was accessible. And many people were just dying, but in 1996, the one antiretroviral therapy was discovered, that is a protease inhibitor, and that has transformed the HIV positive people's life into chronic manageable disease, just like itu dosra kiba bemar na blood pressure, hypertension or sugar bemar diabetes thaka manish na hoise. And then though it is not curable, but at least people can have a long quality life.
Yes, sir. Sir, to amni bi ARK Foundation langa president ase to ami han ge ARK Foundation do kiniga kam pare nuli to ka opor kiba ekta khata ekta ko bole parbo sir.
Okay, thank you very much for that question. ARK Foundation ko access to rights and knowledge na koi ami han aro basically do ami han kila form koise kole do along the way NGOs can only be, government only be. Issue to create, no doubt. But still, at the end of the day, we and when we talk about HIV, we cannot confine to that particular disease itself. We have to also start to discuss about TB in relation to HIV, viral hepatitis in relation to HIV, drug use in relation to HIV, so interconnecting factors and all those issues kan thaki jaba ARK Foundation form kurina. Why not we come together to do and also to give our best to the people who are in need and to serve them. Itulah sakte mo ani to form kurse.
Acha sir, to ami hambi janya nishna HIV/AIDS nishna inya thagile de inya bimar thagise ina ko judo ami hani stigma pula ra dikhi na ase stigma or discrimination thagya any patients kan logode. So do you think ini ajigali sa issue kulu it's the same stigma or discrimination, is it the same na changes kan dolop ayase ninga bhabi ase?
See, this is a very kind of a rough assessment. Will be all in all, cooperado at least up to some extent improvement to the case. But again, having said that, stigma discrimination to now. Still, there are a whole lot of stigma and discrimination that is happening, and then therefore I don't know. The reason why this is still continuing is because I think at one point of time, one to HIV program with the National AIDS Control Program NSAP 1992 were roll out kurna thagena mass awareness campaigns kan thagero thagisile. But still, it time the our key messaging language that we have used. Itu kan bara hai HIV to in terms of drug users, HIV to in terms of sex, itu directly associate kodiya bara. Stigma and discrimination to fuel up kudise, and mostly also because the lack of proper information, as in ignorance is bliss na, or rather little knowledge is dangerous na. Other informations thagya kane to stigma and discrimination to fuel good again. That's where the whole problem of what we are facing even today also. Itu continue kurala pode itiatok bi itu face to kurase. So stigma discrimination has been there, will be there. We cannot I suppose we cannot eradicate or eliminate stigma and discrimination totally in total. Kolebi ko anisna up to certain level of acceptance, people are at least coming out. Nah, but again ko anisna itula po ni en kurule do. Kimang kurase itula po bi jun bishi ko parbo. If not elimination, also at least reduction in stigma and discrimination is possible.
Yes sir, apni dadi kiba add up kole mun jawa.
Stigma is not ito khali ami Nagaland tu nohoy.
Yes sir.
It's a global problem, global issue. As Ketho has rightly mentioned, no? Olebi, I think talking about Nagaland and being a HIV physician, HIV doctor, when I'm interacting with my colleagues in the different hospital setting up, I really have to say that our doctors are not that discriminating to our patient in terms of treatment. Our patient able to get access to treatment plus able to go for operation, which is I don't see any huge problem as such. So that is a very good thing, that is what community and the medical fraternity accepting the people living with HIV. Yes, that is very, very important issue, because if we medical fraternity deny the treatment, then of course people, laymen, will definitely becomes a big issue. So that way I'm happy to some extent. But I think in addition to that, stigma is a big issue where still why infection rate is going higher. That itself is indicated because of stigma. So still have to do lots of work on the mass awareness, as well as involving the people living with HIV to give them the self-testimony, so that slowly people will come out, so acceptance, so I think it's really important, and then that's where the psychosocial counseling plays a very important role.
So could we also say that it's because of the lack of awareness in the grassroots level? Aro any grassroots level like that, ginabi schools, aro any bacha them the right do awareness kan do bishi na di gina aya gani do stigma de pichi de adapt kre na we pabina na sir.
Okay.
Any one of you, sir?
Yeah, awareness bishi na dhiala na hoine. On the other hand, some say that too much of awareness, fed up in a level. But I would say that awareness has to be ongoing. Advocacy, sensitizing the mass stakeholders, the people in need of this kind of informations, but more so importantly, the youth population of today, the young people that we need to be reaching out. Basics, I think Mogan Laga youths are we are very well educated society, I should say. So basics and we have had enough. But HIV is far more beyond the basics. It level of awareness toka issue kushigulido. Be it HIV, be it diabetes, be it any other sort of chronic infections, literally there is no difference. All are a form of disease in various kinds. So why do we have to isolate this sickness called HIV and fuel stigma and discrimination? Awareness to no doubt continue with the corona right population. Are we investing and are we actually thinking and planning in the right direction? That is the big question as of now.
Sir, I'm new to the Kiba adapt Kurlimunjawa.
Yeah, if you look at the lots of HIV/AIDS advocacy, if you look at the history, as I said before, like first HIV documented in 1981, that's also from the MSM, men having sex with men. So that is another big,
Factor.
Yeah, factors, because those are marginalized group. Second thing is when you're talking about like in India, the first in 1987, first tested also it's from the female sex workers. So this is another issue. Then like in Nagaland, the drug is another issue. So likewise, all these are marginalized group, and that has made so much people talk about, and the stigma has been developed at that time. But if you really think, if HIV could have just detected first time in the infant or child, the story could have been totally different. Totally could have been different. So it's basically the people judgmental and misconception, and that is the biggest problem. And of course now globally lots of things have been changing and things are doing better, but still I think we have to do lots of things. And then I keep on stressing, I think whatever it is, the program the government is doing, but yes, we are doing so much things, but then it's basically it's a behavioral change. So the behavioral change is not easy. So you need to touch the people's mind to make them understand that. So only if you touch the people's mind, only things will change. Otherwise, behavioral change is not very easy.
So ni dikit haya ni shina amingan ite kota ko ite kaya ana ay dikit shina ini testing karni bi manuan ini bege manuan HIV positive ase korna janya do mostly ini alak testing kan kurigina turia kan ini ambi bishi thagyo pare holibi mostly symptoms kan jani gina serva koi thage ni shina ajikali youths kan do ni basics kan do jani na se noli basics kan do jani gina thagyo koi to ini symptoms kan dikishe ni jor ke to aya movie itu thagyo na ge kuna ni jor forward aina testing kura labi kini thagina nai noli alak time di compare kule ajikali kini ase tu laga sir.
Any situation ba compel kori testing kora do, that is without any option. Kore ola gya laga option thake olai ja karne ase. Only all in all, nijo risk practice ekta risk behavior ekta practice kodishe. Only ina wala pordebi jania la pordebi voluntary jagine testing kora la komti ase. Only yete moi this angle ekta ba koina human thage in the integrated testing and counseling center. Now maybe in the machinery of the doctor as with due respect to the medical fraternity also, but still one is na OPD just random tests without quality pre-test counseling. Na are the importance of HIV testing kan labi itu na hogine anyone just walking into the OPD itu ange without them literally being aware, making them aware of the testing that he or she needs to undergo in a test good yes. So I don't know whether that will be a forced testing itulale hisapte level ko na kiya sa ina sa ulibi just the people, the public moving in and around the market ke jodi ine khudi se amni HIV test korise na korana korise korea dande voluntary avni jaisina kinega khoise bolido the response may be in negative ulibi kombage aro hudige test question korana to korana gole voluntary chaine koru mona sanna itia the test ko bole monna. I mean there is the idea, and there are a lot of reasons behind all those kind of concept in the minds of the public, but still again there's a different and long story na itia la do voluntary question bole people are not very forthcoming.
Samni tadi kiba add up ko.
Yeah, I agree with you. Voluntary testing is still long way to go. As he said, they come for the medical treatment. That's why they're doing the HIV test, or they're going to operate HIV cases. They're doing this, so this becomes a compulsory. And I don't know how far counseling is being done. That's another problem. So the biggest withdrawal is because maybe people are, without telling them, they've been tested, and then disclosing the status that you are having HIV. That's the biggest shock for somebody's life. And that scares many people.
Yes,
So unless there is a pre-counseling, then people probably will come out and do self-testing. And I think that is not much happening, I think so. And then that's what, so if you explain that, if do early testing, then early treatment intervention can definitely have a long life, quality of life, and you can have a definitely productive life.
The earlier the better.
Yes. That has already been focused and been debate and been advocacy is going on, but then still, it's not very easy. Issue is.
See, there are cases and incidents like, in a way situation like that, Mota do HIV ase, Sadi hoise, Mikey ke lagai dise. Bacha bukhi se, Mikey do maternity ward, na delivery karne na tai jaise. All those antenatal checkup kan kore se. Ito time de HIV test kore lage. Ito time de test kore time de HIV hola se. So now the situation is that Mota bara Mikey ke lagai dise do. Kole Mikey do hai because of pregnancy test kore lage for HIV detect hoise. So it's likelihood that the husband also will be having. Maybe Mota deny karo. No, I don't want to go test. Abuniye kurise, abuniye ina hoise na. But actually he is the one who has actually spread. Itula situation like that. Too many cases such has happened out here in our state.
So ni sa issue gule serba condition cases kandu kiman thage na mostly duan thage na kini nga si rate to.
Na itulaga case if it's like antenatal cases. I know that there are so many people who don't like to test. If it's a wife is tested positive, then husband though we counsel and then why it is very important to do HIV test. But still they'll say no, I'm a test to mona pacheto krobo. And I'm can be we understand the situation, so I'm can be time take your time, but every time they come for follow-up visit we advise them and counsel them that why it is important for HIV test, because now we have so much things that's available in our hand. So that's what we tell them, that not to land up in a last problem. But it's still happening, still going on. It was still there. If it's like parents are positive, then they like to do the children test because you don't have to take concern and just putting them into that. That is happening. But as such, there are discordant couple, sero-discordant couple. Of course, that is also. But now, of course, we try to explain that there is acceptance is happening, but still people don't want to, because of social still discrimination. But it takes time, so it has to go ongoing counseling and ongoing to explain them that it's important for them to do early testing and early treatment.
Stigma, discrimination, thakia na thakia la upward, there is self-stigma. Ite kones na mota kange blame kora la khisa nisna bhi hua ase bole it could be the other way around also. Mikey bara hey wife para mota ke, so but still kones na if the wife is tested positive for HIV, then it's highly recommended that the other partner, as in the husband, also needs to go. It's just a simple test, but still, why don't he or she want to undergo the voluntary testing? It's because of self-stigma. So it all boils down to the level of the gravity of the situation, as in the stigma and discrimination.
Not the discrimination from the community, but Niger laga bitor wa kule muna thage. Sudami ambi niya sir please.
I think it's not the Niger per stigma hoy na. It's because the social circumstances compel them to not willing go for the test. See, if the community's acceptance is there, then nobody bothers. Like you're just going for sugar test or lipid profile, whatever.
Maybe corona la ulop iniga hujan.
Yeah. Only main thing is that still social discrimination and then stigma that is perceived. So I'm just come to Kinga ko
level of acceptance to
so it's very difficult. So that's where the counseling plays a maximum role. So pre-test counseling is very important, followed by post-test counseling, and then follow-up. Because let me tell you, HIV positive comes to you and you do counseling, you rattle out so much information. It is just going from here to this side, okay? Because for them they are still in shock. They don't know what is hitting them. So again, next time they'll come, they'll ask the same question, how much you spend hours to talk to them, the same question they'll ask you. So that indicates they are still in shock. So I think we need to understand the stage of HIV. Once you infect it, people go for shock. Then after shock means, what is shock means they get like stars, they don't know what is happening to them. Second is self-denial. Oh, I think it's a dream. Itu sapna to asa bola. Inga go they pinch them, but then it's not sapna, it's a real inga hoje. Then they start blaming game. Why God? Why it's me? Why what I have done? No? Inga kila mi inga hoje. Mi to bhal man shanse ki inga hoje. So blaming game. Then so this goes, and then some. If so, the question of counseling is very important here. That the counseling no correlate to come on to, they can go two way. One is self-destruction. They can, okay, I'm not going to live long, I'm not going to have quality of life, I can't get married, I can't have my, family. So let me enjoy my life and do whatever I want. So they can go to self-suicide. They can, why should I suffer alone? Like kind of attitude, and they can even rampant infect it other people also. So the counseling is very important, make them understand. Then they slowly, they come to acceptance. And that coming to acceptance, self-acceptance that yes, I'm living with HIV, it takes very, very long time, but ongoing support service is very important. And once people do develop self-acceptance, I think this family or peers should have lots of support service provide. And then once you support that person, then they have self-acceptance, then so we have to empower them, and we have to also not only empowering them, but they should be able to do some productive life. So then they becomes more accepting themselves. So I think those are very important.
In addition to that, sir, serba koi thage nishna inga time de patient laga mental health or mental state bi bishi matter kre. To inga time de ni counseling do kiman important ase aro ido important hoina aro family members can be patient laga tala mental state ido understand kuro kiman important ase aro kiniga ido gi cater kuro parbo.
Again, a lot again interview moi bise word ekta halela do aro ini sabo social acceptance na, be it from the larger society or be family as a social group hochule itu la debi acceptance level de bishi kumti ase. And therefore kwan is na even if that person now knows that he or she is with HIV, getting accustomed to this new world of now being an HIV positive person, it takes time. It's a process, it takes time. Like one is na during that process they undergo a whole lot of mental trauma, and therefore counseling plays a very important role. I think medications and all those are equally important, but medication is for the body, for the physical, but counseling is for the mind and the spirit and the soul. Counseling is important. As a person who works with HIV positive people also, over this past many years, though I say that counseling is important, I want to still again question about what is the level of the quality in terms of counseling that we all are providing. Mogan tagan ke counseling is just to tick in the counseling register that we can say that our counseling dishe karne tick kuribole karne namuna da counseling diasna. Are we providing then the true psychological support and the intervention in the form of counseling that he or she needs. Idone kwanasna counseling do lage quality of counseling the mohan diasan nai.
So ni just I should ni quality counseling diuli laga jaga kan asna nai Nagaland dibi. Ase kulebi kwanasna and there's a whole workforce, medical facility power bhi ase, manpower bhi ase, infrastructure bhi ase, to nahi to be one away. We cannot deny that. Ole kwanasna even the many of the treating physicians, keeping aside Dr. Toghuka,
kumbado I'm just saying I'll not be very particular to any doctors or counselors or things like that kind of a little general kolibi kwan isna patient walks in kolibi counseling to provide na you have the manpower, you have the facility, you have everything, but are you spending quality time with that person? And counseling is, I believe, more or less about hearing the person's perspective instead of always giving advice and feedbacks and suggestions. So are we available for that person at that time when that person needs us the most? Itu asana. So sometimes I become very controversial kolibi itu kwala pore aru moi doctor holebi counselor hobi henteng kange aru blame na kuru na because our system is built up in such a way that that person person has to oversee 50 or even 100 people to ekjon ke on a day 50 jon aise gole to avni 5 minutes spend korise gole you will be totally burn out. So manpower lagi la poribe ase. If I as a counselor, I can counsel only 3 to 4 person a day. Usually that will take 20 to 30 minutes per person on an average. Very generally ek ase. To moi 20-30 minutes ek jon to 5 jon 6 jon ke ek din de consult korise gole moi 3-4 ganta to kotha ko ase to. So that's going to burn the whole of my energy. Either na tai aise gole to 1-2 minute counseling to na ho. But that is happening. So having said that, my tagangi blame no nadibo. I think it's important that the government invest more, build more infrastructure, set up more testing and counseling centers down to the PhD level or even at the dispensary level. Counselors can shortage of counselor in all the ART centers or in the ICTC centers are the most common problems that I also keep on hearing. To makan problem to diagnose korisu solution do aru naniero then the problem will continue.
So that apni kiba add up kole mun jabo.
No, actually, I mean, very important is we need lots of human resource, and then when we're talking about the human resources, people been qualified for the counseling, no? Then only the quality will come out. Otherwise, any damn dog here comes and couldn't be so by counsel group any job I seen got to come to Korea. Take one to like looking at the Diagnostic hospital, ART center. At least patient to 100 patient to turn up cross
everything.
To Kali to the doctor as counselor to do that in the you can't expect to come so to quality service to develop. It's very, very difficult. I think the investment is worthwhile investing in the human resource and the infrastructure so that people get a better information, awareness, and then, so automatically it helps in the preventions.
Yes. Moi the question hodi bole mon jabo ki sir ami gan bi dikhi dage nishna HIV/AIDS la cases kando noli to pilara ayase to saishugili ajigali laga humoi de saishugili increase wise na decrease wise do kiba ekta kole mon jabo tade
day by day jaishugili ne increase hogine jaye ase every day people are getting tested because of various reasons in different settings and avenues. So the more testing, the more cases have been reported or rather detected. So if we want to discuss a little bit about the facts and figures,
yes, sir.
The exact tonight will be as of March 2021 this year will be officially more than 20,000 in terms of case detection do part of Pagidase. And I think on the treatment part, Dr. Tuahijawa will be out of those more than 20,000 kando, almost more than 10,000 are put on the ART, that is the antiretroviral therapy. The story, sad side of the story is that we have lost a whole lot of precious human lives to this. Though it is a manageable, treatable kind of a disease, bishi manu murise 2-3,000 manu murade murise. So mogan facts and figures la kotha wala pode hoise guli aro cases to again the it will keep on increasing. And Nagaland laga senior again going back to the history, 1990 they detect and now it's almost like 30 years, 3 decades that we have had HIV in our state. So since the beginning of the entire program and the ART program way back 2004 and now 21, Iman jonge he HIV treatment de dalio parese. Now the government is providing free of course. So where are the missing 10,000 people? Why are people failing on treatment? Why are people dropping out of treatment even if they were able to be initiated on the treatment? So instead of rather giving answers and also to the fulfilling the things that the viewers need to know, question la question but those are some things that we need to find the answers upon.
So Doro saishugulini age group kan kundu bishi thaganishna zini data sala isapte.
I think actually 2000 they have done the HIV screening in Nagaland from 1999 to 2018. They out of 20 lakhs population, 2 million population in Nagaland, they have screened for HIV around 10 lakh 7,000 something like that. And they've found positive rate of HIV positive was around 22,878. So that was a figure present HIV positive people in Nagaland. And coming back to people who are accessing the antiretroviral therapy registered in the government ART center is around 16,000. In that, around 11,000 is in Dimapur. So that is a case, and then I'm sure that the infection is going up because if you look at the Dimapur alone, last year 2019 April to 20 January, that's not even 1 year, around 7 months. Dimapur infection around, they've tested around 1,200 approximately, and then they found around 940 HIV positive in Dimapur town, Dimapur alone. So definitely, and then so that's a figures. That's what according to Nagaland AIDS Control Society. That's a government report.
So what could be the most common cause? Ki karne do what say do?
So I think it is the root. We all know that the root cause of HIV in Nagaland scenario is, I think, 91 to 95% is through sexual route. That has been what everybody says, and that is a story that's going on. So I think they're here, and then also, though we used to, people used to think HIV is only people who are drug users get HIV, or men having sex with men, or sex workers, or drug users. But the stories now is coming, it's gone to the general public, and the more dangerous and more scary and more serious part than before is that mostly and very significant is a youth group. Right. That's the age group between 15 to 35 age. That is the highest HIV prevalence. That's why in India statistic, in India HIV is the second adolescent population of HIV. That's almost 1.45%. That's very significant. So India is the second highest adolescent HIV in India. And then I think below around 14 years of age is around 6%, and then between 15 to 24 age is around 15% of HIV in Nagaland. So these are the facts and figures.
Alop tare kurumle mon thake do. Etia ami kan discuss kora kan do what has been reported and what has been detected. But still there are too many people who have never got tested. Correct. And still do not know their status and moving around, or maybe getting involved into all those unsafe sexual practices, and therefore more than 90% of the overall number of cases detected of HIV infection was and is through the sexual route of transmission.
Okay. So Daro ini seriglo de jabo itia treatment kan do kini ga thage HIV AIDS laga do any stages kan do all explain kuri do sir.
As far as the HIV treatment, right now I think it's become easy to treat HIV. If it's a street case of HIV, means only HIV infection, I think it's very easy to handle because we have a very best medicine available right now. What is available in the US, we have available in Nagaland and such. So of course in the government sectors is different, but in the private sectors. So and then on top of that, right now the government of India and Nagaland are set up all the ART centers and people are able to access to antiretroviral therapy. So it's a pretty good case. But again, coming back, that people who are testing late because they become sick because of some maybe TB or maybe brain infection or lung infection, can't able to itu sas lobo no pare atakan ka unconscious kurigena hospital ha para ta HIV zane kan late stage kan diagnose kora to be bisha na itu. So those are the people, but still it is not impossible to reverse back to normal because all we call them is an opportunistic infection, means because of the HIV virus body to ha karani am kan laga immunity kamjor ho jay. It was like our immunity, our shakti takot kamjor ho pra an kan bemar somar bishi pai jay. But it can be, it can to sub treatable, and even patient to coma thagile pi unconscious thagile pi to reverse to koro pare. And we can put antiretroviral therapy and they can go back to their job or can live long life. So it's become so easy. So it's now the available medicine, we call it HAART. It's HAART, highly active antiretroviral therapy, which is now available in the I mean globally it's available. And then there are so many options are available again. No, you can choose so many varieties which regime you want to go. No, and let me go back to like when I used to practice in the early 90s. Those days ART medicine was not available in India, was even globally it's not available, and very few medication used to be like cost around 30,000 per month, and people man come to only 24,000 pills, 24 pills, no tablet khabo lage, khai kene vomiting kura side effect bishi kurgen bi mure. Only be yete to ole refined research to advance, iman advance kurgen refined kurgen yete to ole advanced research hopra medicine pi becomes only one pills, ekta tablet khabo lage, so becomes so friendly to patient, for very less toxic. No? So even this helps in terms of stigma also, because one of the issue in between I just come one it ekta issue to ole non-disclosure of the status has also making people not to continue medications. No, because for example, ami bemar thakena pills, suppose if I take pills morning khale, din khale, afternoon rati inka khabo kole to kunba to office to kam kora ase, kunba even family to ko disclose no kurgena thake status na etu kan to sati kan to dibo kile medicine kha ase kole one day to ami matha beka ase pet beka ase ko bole hoda to kobon re na excuse to marbo no pare na etu prata kan discontinue kore that is bishi complication hoy jay. So at least those days is over because we have just single pills, or most or one or two pills. It becomes very easy, very friendly, less side effect, and very important points. Now, people, if test early and then diagnose early at the age of like 20, 30 years, and put on antiretroviral therapy, that's called ART. Now the people can live long life. They can live up to 80, 90 years. Just like a normal expectancy life. Sure. Okay, they can have a family. They can have their own family, because that's lots of interesting study research has come up. So there is called like U is equal to U. It is called undetectable viral load is equal to untransmittable of HIV. So that becomes a huge campaign globally, and then it's lots of huge study has been done. And the serodiscordant couple to matlab to hole ekta man to positive, say maki to positive or mota to negative positive or ekta to negative, no, vice versa inka tai khan itu ki study kurse itu kinka study kurse gole kun HIV positive ase tai khan ART dishe ART dikene tai khan full ART body to virus body to full suppress undetectable rakje inka more than 6 months, no, inka kurgena itu khan make them to have a sexual exposure to their partners. It could be wife or spouse or friend or partner, anything. So that has been studied in the 4 or 5 different centers globally, and then they found that I think they calculated all these sexual activities more than 78,000 episode, but around 3,000 to 4,000 people who are recruited in that study, not a single HIV transmission has been taking place. So after that, it's become U is equal to undetectable, HIV is untransmittable. So the important message here is that HIV treatment of this ART is not only for the person who is HIV positive, for his improving his quality of life, long life longevity. It's also as a prevention. It becomes a very important. So it becomes a very important. So that after this antiretroviral lot has come up, we can say that half of the HIV infection rate is reduced because of this antiretroviral therapy.
So do medication or treatment laga do sahi na mon aro infrastructure ini HIV/AIDS patients kan ge sauri laga ini infrastructure laga upor de khota kole government ba pa laga tade is it enough nole is it kininga paina se to kiba kole mun jaw tade
you want to go ahead and
yes please sir.
Maybe if you want, I can tell.
Okay.
Because you are more in the government.
Yeah. No. To your question, my direct answer is no. And the fight for a better diagnostic facility and treatment monitoring facility, ito is all American Julia. So HIV hoishe treatment yeti ase. Along the way, itu manudu series of clinical investigation kuru lage. Out of which one important thing at that point of time was a certain thing called the CD4 count test. So ina hua to ki hoise Nagaland state te 4ta machine thage to pura breakdown ho thage na banaise next week biya ho jabo next month 1 mahina 2 mahina to karo biya hoigina thagibo repair gora biya third hand bi na fourth hand bi na fifth hand laga itu Manipur re condemn hua roe mogange pathaise. That's one of the sad part of the story. Believe it, the CD4 era is gone. One is now better with more research and development, scientific research kind of more better regimen treatment has come. So it is more quite CD4 necessarily nalage. Believe there's a certain thing called viral load test to determine the level of the viral load in that person. So itu laga assessment to monitor his treatment. Itu viral load to baseline investigation kurela apode after 3 months be aru viral load kurase if that person is on DTG. But anyway, 6 months usually kurase. To viral load test into itia moga laga sub district te kiman available ase. Again itu question mo anyu mon ase. Na ole kali just giving the medication and without providing the following monitoring investigation facilities, that does not suffice to a treatment response. That does not necessarily determine or indicate whether that person has achieved undetectable viral load.
So Toro sal age debi critical medication HIV patients kan kane na thagya kane man approach thagishe. So do you think it will government la side for neglect thagishe sir?
In terms of
yes, critical medication, sir.
No, I think of course time to time it used to come up, especially interrupted supply of antiretroviral therapy in the government ART center, and that's a stock out, we call it stock out. And then so the important is when we are putting HIV medicine ART to patient, we ask them to take regularly, not to miss even single pills, because what happens is the virus, this ART is very sensitive, it can develop a resistance come no crobok na itu pa hoda khabo lage inka koi hole bi government supply to suppose stock out interrupted supply thagle to patient come to le itu to le kwasa hole bi problem create cross hai aur am kan unfortunately Ketho Angami actually Nagaland to Amkan HIV viral testing government center to nahi, and that is a very very important because now the whole taking the success of the treatment is only based on the viral load testing, so that is not been there. So that's a big issue we have, and of course apart from that main human resource infrastructure. So I think lots of things need to be addressed.
I just want to supplement again. Of course, because of COVID, one TrueNet TrueNet use even for viral hepatitis B, na laga halagula hogine dia mangine itu viral hepatitis B kurala pore HIV live kurasa bolibi every Wednesday kurasa. So in terms of the client load versus the facility and the frequency, there's a mismatch. It is common. Bolibi going back to your question, why drug interruptions to at one point of time. Fortunately, these days, but anytime it can happen. So we need to be prepared for that also. And therefore, we have to even write to NACO, the National AIDS Control Organization, file RTI, and during the CD4 machine, we even went up to the extent of, I don't know, key level le jawa bole be na hobo na way to banao lage the machine to thayo lage la level talk of advocacy going. There were a lot of arguments and we had to sit on the other side of the table, and but we're all advocating for the rights of the patient. So stock out lagambi mugan, we have to go to the court to file a complaint, to file litigations also na. So ART stock out hoja, and kali adult laga dosage na hogine in terms of mother to child prevention la never raping gone ekta drug tage itu tok mis stock out hogine dangor manu laga mihing gone bacha ke khela. How inhuman is that? Though our hobby or our interest is not to be running around the court, we have to stand for the right of the people who need this kind of service. Though we don't like it, we have to. If the government don't do it, though they know the things that needs to be done, na kurilo do mukhang kobo request to nahuni sigule do fine. Let's meet in the court. Ito asa.
Sir, amni ito needs laga opore HIV patients kala needs laga opore amni kui thage nishnaro continue kurule balo sir.
Anyway, long story asa asole ito olebi ele manuke treatment te daleo mon to facility thik kuribi na kotha re ito ase na Amigan laga SDG or the country's aim to eliminate HIV is 2030. So 9 years bachi ase. So infrastructure facility or mugan show suru kura dande counseling laga stigma discrimination and we should all put our force towards that na. Ito ko muna. Ale kuhanes na again switching gear mugan. Despite all those challenges, it is our COVID situation way back last year March para mongala country or mongala state be hardly hit kurigine. That time it was a whole lot of a nightmare, especially for the community of people living with HIV. To say that the program has literally collapsed at one point of time. Tangana ART medicine to field staff, they've done a tremendous job, I should say. And even out here, Nagaland State AIDS Control Society, they have also done a tremendous job to ensure that anyone who is on this ART regimen do not miss out his or her dose. It will accept the staff can, NGOs can, door to door in a Only what transpired in all this, the challenges keep on coming out again, new challenges. We address that, new challenges keeps on coming out. So hardships kept on ever increasing. If in bishi kurule kujus kurasa kulebi itu hardships overweight kudi ina hoja bara hai bishi problem wala jagine mogan stock out shortages kala ko because of COVID induced lockdown relating curfew things like that. Travel guru na pare public transport na thing ba hiyo gulibi police kan danda mari de. So I can ART center logo bolibi, and more so also because every hospital were converted into COVID care hospital. So even HIV positive person or any other general people also who needs medical attention nowhere to go because all the hospitals were now COVID. Ito time digo mukhala argument de thagise. Of course, COVID is a public health threat and it's a concern for all of us. Will it be because of one emerging public health threat in the form of COVID? Why should we put an already existing health threat in the form of HIV in the backseat.
Yes.
Eduke neglect kuni eduke sabonige. We should, as health this thing activists or from the government side also, the health and family welfare department should keep, I mean, give equal focus na. Ipine saigene ipine neglect kori dialo itu khushi na pai. Kone tarebi ami kan bishi hue and cry ola she inala na. And still now that kind of situation also is happening. No doubt itia a lot ease of restriction can unlock 5 hour a lot in other ase, so in out of ART center in other ase bolibi because of the COVID thing HIV can give ekdom hard hit kurala ro daily wage errors can give bishi yo however. So very coincidentally today this morning I'm from Kohima, so Kohima ba pozo 3:30 ba thing na pola gane sukube alo lal likhi asola bolibi I had we were as ARK Foundation and the network of Naga people living with HIV NNP plus moneki lore miligine we raised, I mean projected the need of the community to the join UNH program, and following that we got some financial assistance from the World Health Organization in our Kohima ba polagina hina ji one dry ration distribution can be kuriye thagine yada ahiala asena. So moi itu story ki le ko ase ko HIV problem to continue korase. Now COVID, now everyone is like vaccination and then things restrictions are being eased out, things like that. The after effect of COVID is still happening na. HIV mohan government go mo kuman ta gitu itu ane infrastructure kan build up koro lagi mohan you is equal to you now lebi eliminate HIV in the country or Nagaland state by 2030. If that was to be made a reality, yadeki na ito sabina uto 2030 na sabina. Aro just I believe yesterday government laga target also in the SGD by 2030 mogana nijor Nagaland government bi HIV do eradicate kuro gone. They have committed to it. So political will is no doubt there, but we demand political action.
Sir, I'm new that you adapt kuro mo jawa.
That's good, quite good enough.
You're satisfied with whatever he said.
Yeah, that's fine.
Okay.
Sir, amigan kuita gani na ini idu welfare support karni bi ini HIV patients kan ge idu government right to sabi kini ga ase sir.
Jaha gune bisao lagi na wale divide gune man welcoming ba na die na. So of course NGOs can be ne mobilize group par ase agede moi ko ala mongala initiative we were able to mobilize. Or even Kohima district laga kisa mario gole do district administration barbe mohange because we sought support from them, they give it to us na ina ko ne mobilize kan kori ne dero dia sa gole be. I'll be very honest out here, us giving dry rations, we are not doing something really big. Giving dry rations is just going to last the family for 2-3 days. The rest of the month, the rest of the 3 weeks they can kick our. We cannot give for the whole of the month, for the whole of the year, for the whole of the family. At best we are giving some small nutritional support na. To one is na NGOs can be, we are all as a team out here, but the end of the story for this is to say that the after effect of COVID related lockdown has hardly affected them so much that they are still in need of the help of the government and of the public, especially the church forthcoming whole again. Aro NGOs can do what kiki ba mobilize ko na hiya to do. I don't know the story of each and every NGOs, but I keep on hearing everything from my colleagues, Facebook or Instagram or your news channel, also things like that. One is na COVID and all this after effect related what itu lagado thakibilas is going to continue for a couple of months, if not
but
few
I
years.
think if you really look at the welfare war, we need to think about sustainability. Otherwise, ini aji all of dibo 2-3 days to Kodomojo. I think it's just tokenism. So I'm babna tole government, of course, you said like a political will that has to be their commitment from the government and respond to HIV/AIDS, no? Especially the welfare of the community of people living with HIV and the widows and orphanage. So many things we have. I think there should be a real strong policy, and that should be not only by the government, not only looking at the central laga scheme, I mean central laga guideline follow no Koreana. I think government should able to understand the needs of the local people and the requirements in order to sustain that. That's where they have to engage the community, especially the civil society and then NGOs, and of course involving people living with HIV in that, so that they can come and then develop some sort of solid, package or strategy, policy, where they can implement that, and so that can at least sustain to extend then, because once you give skills and the developments of the community, of course, they can only survive. It's like a story, You have to not only feeding the fish, but you have to just make them to what they call
how to catch
how
fish.
to catch the fish.
Master
So
relation.
that's very, very important. So I think right now whatever bits and things where itu kan kurato I appreciate, because when people need it, but then we need to think in the long-term goal. So at least that will be sustainability for the community, as well as that will reduce the burden of the government problem, as well as at the end the prevention, reducing the infections, that will all happen.
So to are coming to an end of this conversation. Amidu hudibuli munjaw sir. 2017 de ARK Foundation kanbra Governor of Nagaland Acharya ge likhishe ki HIV-AIDS niga kam kriya manuhan baba kam kriya manuhan ge Governors Award diwole laga to tulo opportunity new time de response kinya thagishe aru apni bi since ita to governor wi nutun aishe to ini itu aru propose krile plan asna nai sir.
In fact, आगे की मन लुई जाओ ला ना होने government side पे ना बड़ा बिशी आरो पीछे लुई जा रही है तो your question again governor वो तो भी जाए जैसे वहाँ ला letter भी कोई ऐसे ना जाने वैसे our public representation itu भी कोई ऐसे itu भी ना जाने but to top that again the government of the day legislative forum on AIDS कोई नहीं थे itu भी disband को दिसे NGO कंबार को ऐसे to encourage people who are giving the most to the community and serving the most neediest person can get recognition kuribi koala kisa charegene the political commitment laga platform ni tagan disband korise so backtrack kurase the other thing is again policy ko arane yad aise HIV-AIDS Act 2017 do enact kulise. Our state government is still yet to appoint an ombudsman. Ombudsman ko na ekta designation tage. Until and unless that happen, all the stigma related things that we were discussing, the complaints can be addressed and cases are happening, but it will continue going unreported. People will continue suffering. So it will like say I'll also cite this in a little bit of a narration. Meetings, workshops, many times we have flagged off the issue to the government and the concerned department, as in Health and Family Welfare Department, to be very specific. Concerned department, I'll be very specific, Health and Family Welfare Department, okay, and the wing of AIDS control program, that is NSEX. We can discuss kiki reason online and one good excuse for many people is COVID. अरे COVID time दे अपनी बात खाना नहीं, COVID time दे अपनी होमाना नहीं, COVID time दे अपनी सांस लोगों पाहुरे नहीं, COVID time दे अपनी किले काम करो ले पाहुरे से, ना किले काम करे ना है. Deliberately you didn't do and you blame on COVID. That is not justified. इधर लाये सब ते आदमी कान बीसी बाई दो embassment लाये कोई से some other partner NGOs, Kripa Foundation also has given a press release as there's a body called Network of Nagaland Drugs and AIDS Organization. I'm also the General Secretary of that. So me and our team, we have also written to the Governor with a couple of signatories from other sign-on NGOs. No action taken. Principal Secretary called us for a meeting to deliberate on this, constituted a committee for the appointment of ombudsman. Nothing happened. Finally, we filed a PIL and it has been listed yesterday.
Yes.
Korte Lokurwaro.
korte ঠিক আছে তো আজি লাগা ডিসকাশন কাৰণে আমি খান ইমানেই কৰি থাকিব আৰু চাসি কি আমি খান আৰু ফিউচাৰ দিবি ইটো লগা পৰি আৰু ভালবা ডিসকাস কৰিবলৈ টাইম পাব কৰিনা আমি জুম্বি আৰু একবাৰ থ্যাংক ইউ কলে মন যাইছে আমি জুম্বি
In fact, thank you everyone and thank you dear viewers for watching our show.
Thank you so much sir. तो आज लगा डिस्कशन करने माने थगे वो विश्वास আছে कि আমি খান লাগা viewers can be HIV AIDS লগা উপরে আৰু জানকাৰী গান কৰিবলৈ নইলে তাদেবি ইটো লগা ভাল কাৰণে বি কি কৰি আছে গভৰ্ণমেন্ট বি কি কৰি আছে আৰু আমি কি কৰিবলৈ লাগি আছে ইটো লগা উপৰে আৰু মন বেছি কি না থাকিব কইনা ভাবনা কৰি আছে তো আজি লগা ডিসকাশন কাৰণে মানে হ'ব আৰু আমি খান এভৰি উইক এনেকা ইম্পৰ্টেন্ট আৰু ইন্টাৰেষ্টিং ডিসকাশন গান আমি খান লগা টক শো আনফিল্টাৰড আপনি গান গে আনি থাকিব আৰু আলাক খবৰ কাৰণে চাই থাকিবি হৰ্নবিল টিভি